We'll be covering a heart attack. The heart attack is also known as an MI. MI would be our myocardial infarction. It is actually the cause of 600,000 deaths a year. About 1 in 4 deaths a year due to MIs, and that's actually percentage as 25%.
So what happens during an MI? And what happens is it's a blockage of the coronary artery, which is right here in black, coronary artery. And what the coronary artery does to the heart is it supplies it with all the blood and oxygen it needs to the ventricles and the atria, the muscles in the ventricle and the atria, the myocardium. And when it gets blocked, it deprives those muscles of those nutrients, and it can cause damage and death to the heart muscle itself. So this is a close-up of the coronary artery, and blood flow will be going to the heart this way. And how it gets blocked is there is someone with a high cholesterol. Cholesterol deposits build up in the coronary artery, and they get bigger and bigger. And this forms a layer of plaque on the artery wall. And if there's enough of it, it can actually cause a clog in the artery, especially if there's a thrombosis or blood clot.
So the common sites for this obstruction will actually be divided into these three. We actually have the left coronary artery, which you can find right here in the heart, and that's going to be about 40% to 50% findings of these obstructions in that artery. Now, about, I would say, 30 to 40% are common findings of this obstruction in the right coronary artery. Now, that can be localized here within the heart. And last but not least, you can actually find 15 to 20% of these common sightings of obstruction right on the right side of the left coronary into the circumflex branch of the left coronary artery. There you go. Now, the blockage of these coronary arteries would actually have the cause of damage of the heart muscles. These low counts of blood as well as oxygen will actually show signs of common symptoms. The major common symptom that we'll find of heart attacks would be chest pain. Another good sign, secondary, would be discomfort. You'll be rubbing your chest a lot, so discomfort. Another good sign of a heart attack would actually be common shortness of breath. So we'll have it here written, shortness of breath. And last but not least, we'll have nausea. These are common symptoms.
One of the most common ways to diagnose a heart attack is with electrocardiogram, ECG, sometimes it's EKG. And this is a normal strip of the electrocardiogram, and we can break this down with, this is a P wave, this is the QRS complex, put that down here, QRS complex, and this is the T wave. So all these can be described. The P wave is the atria depolarizing. The QRS complex is the ventricles depolarizing. And the T wave at the end here, T wave, is the ventricles repolarizing. So when compared to a normal rhythm, EKG, this is a rhythm of someone going through an MI. And as you can see here, we have a P wave, we have our Q, we have our R, but our S and T are elevated. They call this ST elevation, and that's due to the ventricles not firing correctly, and they're not depolarizing and repolarizing correctly. And in hospitals, you sometimes hear them say STEMI, and that stands for ST elevation MI.
So treatments of a heart attack. We actually have blood thinners. Blood thinners would involve aspirin. We also have nitroglycerin, which would improve the blood flow through the coronary artery and reduce the workload on the heart. And last but not least, we have angioplasty, which is actually a non-surgical device that actually enters the blood vessel. And at the very end of it, we'll have a balloon that would inflate to hopefully open up the blocked artery or block the blood clot. And if necessary, a stent will be placed in.